Looking at the grim situation in India's fight back against the coronavirus, Prime Minister Narendra Modi has now cancelled his election campaign in Bengal tomorrow. The Prime Minister will instead chair several high-level meetings to review the prevailing situation, the crisis and the fight back. Prime Minister Narendra Modi will first hold an internal meeting, an assessment of the situation at 9 in the morning. Then at 10 in the morning, he will interact with chief ministers of the worst affected states, high burden states, about 11 of them. He'll be interacting with chief ministers of the high burden states, and then at 12:30 he will have another meeting with leading oxygen manufacturers. Of course, these meetings are all via video conferencing. The Prime Minister was to address multiple rallies in Malda, Murshidabad, Bhawanipur and Birbhum tomorrow. All of these stand cancelled and now will be organized virtually. And Delhi Chief Minister Arvind Kejriwal has thanked Prime Minister Narendra Modi and the centre for raising Delhi's oxygen supply allocation. Addressing journalists on the prevailing situation in the national capital, Arvind Kejriwal said that the centre has helped the Delhi government and assured Delhi of smooth supply of oxygen. Although the centre raised the national capital's oxygen quota from 378 metric tons to 400 metric tons on Wednesday, several hospitals continue to struggle to replenish oxygen supply. While some of the bigger healthcare facilities did receive additional oxygen supply, the smaller hospitals are grappling with a shortage of oxygen and a huge spike in coronavirus cases. The Delhi High Court too has directed the centre to immediately ensure that 480 metric tons of medical oxygen is supplied to hospitals as quickly as possible. The High Court had pulled up the centre, asking the centre why hadn't the government woken up to the ground realities earlier.
दिल्ली सरकार ने अपना एक एस्टिमेशन लगाया जिसके हिसाब से दिल्ली को रोज़ाना 700 टन ऑक्सीजन की ज़रूरत है। केंद्र सरकार ने हमारा कोटा कल तक 378 टन तय किया हुआ था। ये कोटा कल शाम को बढ़ा के 480 टन कर दिया है केंद्र सरकार ने। इसके लिए हम केंद्र सरकार के बहुत बहुत आभारी हैं। हालांकि हमें अभी और भी काफ़ी ऑक्सीजन चाहिए, लेकिन केंद्र सरकार ने जितना भी बढ़ाया है उसके लिए हम उनका बहुत बहुत शुक्रिया अदा करते हैं। दिल्ली वाला हरियाणा की मदद करे, हरियाणा वाला बिहार की मदद करे, बिहार वाला गुजरात की मदद करे। हम सारे लोग अगर एक दूसरे की मदद करेंगे तभी तो भारत बचेगा। और अगर इतनी मुश्किल घड़ी में भी हम सारे एक दूसरे से लड़ने लग गए तो अगर भारत राज्यों में बट गया इस समय तो फिर भारत को कौन बचाएगा। मेरी सारी नागरिकों से अपील है, सारी सरकारों से अपील है कि आइए मिलके एक होके लड़ते हैं। अगर हम मिलके लड़े एक मुट्ठी बनेगी, हमारे सारे संसाधन मिलके एक साथ इस्तेमाल होंगे, हमारी ताकत बढ़ेगी, हमारी शक्ति बढ़ेगी। और अगर हम बट गए तो फिर कोई हमें नहीं बचा पाएगा।
ऑक्सीजन, रेमडेसिविर,
दिल्ली वाला
So as India struggles with oxygen shortage across states, the centre has now issued a fresh directive to ensure smooth supply of oxygen between centre and the states, between union territories and states. Now, according to the new order, there shall be no restriction imposed on the movement of medical oxygen between states and union territories. There shall be no restriction on the manufacturing and supply of oxygen between states and union territories. And there will be no restriction on vehicles carrying medical oxygen between states and union territories. So, supply of oxygen to industrial units, apart from those exempted by the government, also stands restricted from the 22nd of April. The situation remains extremely grim, not just in Delhi or Mumbai or Maharashtra, but let me now take you to Uttar Pradesh. The number of COVID cases are sharply rising, and so is the demand for beds, oxygen and essential medicines. Today, we take stock of the Prime Minister's constituency Varanasi. Let's just check the efficiency of health infrastructure and how people are coping in these troubled times, in this unprecedented crisis that has overwhelmed the healthcare infrastructure almost across the country.
Oxygen, remdesivir and beds. Visit any hospital in Prime Minister Modi's constituency, be it private or government run. These will be the words one would hear from panic-stricken family members of COVID patients. Ravi has been sitting outside the gates of the COVID hospital in Banaras Hindu University area since Tuesday night, waiting for them to admit his COVID-positive wife.
डॉक्टर ने उनको बोल दिया कोरोना है। रात 12 बजे से मैं यहाँ लेके बैठा हूँ, कभी चौरा से लेके बीएचयू तक मैं 5 चक्कर लगा चुका हूँ। अभी तक कोई भी सुनवाई नहीं हो रही है हम लोग की। कभी चौरा कह रहे बीएचयू जाइए, बीएचयू कह रहा कभी चौरा जाइए, और पेशेंट पड़ा है, कोई इसकी सुनवाई नहीं हो रही है। जबकि यहाँ की बीजेपी गवर्नमेंट यहाँ के मंत्री कह रहे कि यहाँ बहुत सारा मतलब यहाँ फैसिलिटी है, आप पेशेंट लेके आइए। पेशेंट किस तरीके से लेके आया जाए?
A government doctor herself, Rama, is restless as her husband is admitted in a private hospital and had to wait for hours to get a remdesivir injection.
रेमडेसिविर के लिए बोल रही थी नहीं है, लेकिन मैंने सीएमओ से रिक्वेस्ट किया तो शायद आया है, अब लगने जा रहा है।
क्या भैया क्या दिक्कत आ रहा है?
Doctors have given up due to lack of resources, and even knowing someone is no longer a help.
मेरे एक मित्र हैं, उनके पिताजी का हालत कल रात में 8 बजे ख़राब हो गया। उसके बाद मैंने तमाम हॉस्पिटलों में, डॉक्टर ने कहा कि वेंटिलेटर की आवश्यकता है, और मैंने तमाम हॉस्पिटलों में प्रयास किया, कहीं भी भर्ती लेने के लिए कोई तैयार नहीं हुआ। इसके बाद मैंने सीएमओ साहब को फ़ोन किया, लगातार मैं फ़ोन करता रहा, 35 बार फ़ोन किया, मैंने नहीं उठा।
While Shamim claims he was denied help by the district magistrate, the officer admitted to a shortage of beds with oxygen.
जो 2 ऑक्सीजन के स्रोत वाले बड़े अस्पताल थे, बीएचयू और कैंसर अस्पताल, उसमें भी बीएचयू के ट्रॉमा सेंटर को आधे को कोविड अस्पताल में कन्वर्ट कर दिया गया है। आज उसके 60 बेड और नए चालू हो जाएंगे, 30 बेड उसमें कल परसों में फिर जुड़ेंगे। करीब 90 बेड का हम लोगों ने ट्रॉमा सेंटर बीएचयू में चलवाने के प्रयास पूरे किए हैं।
According to reports, people have now resorted to buying remdesivir illegally for as high as 15,000 rupees per injection.
इतना ज़्यादा मैंने एफबी पे हर जगह अपलोड किया कि किसी के पास रेमडेसिविर का कोई ऑप्शन है तो मेरी कोई हेल्प करे, लेकिन सारे लोग परेशान थे मेरे साथ साथ। फिर जाके किसी ने मेरे दूर के फ्रेंड ने मुझे फ़ोन किया कि भाई एक जगह लखनऊ में शायद मिल सकता है, लेकिन दिक्कत यहाँ पे ये है कि शायद वो इंजेक्शन 1000 का या 4000 का एमआरपी का इंजेक्शन है वो, और मैंने दुकान में भी अपने 2 महीने पहले से मैंने वो इंजेक्शन बेचा है 20% डिस्काउंट करके, एमआरपी से नीचे में मैंने बेचा है। लेकिन जब आज मुझे अपने खुद के लिए ज़रूरत पड़ी तो पता लगा कि वो इंजेक्शन 15,000 रुपये का एक पीस मुझे मिलेगा।
Varanasi has 3 government and more than 18 private hospitals, but the conditions remain the same everywhere. Bureau Report, India Today.
This isn't the story of any one city, one state. India's healthcare infrastructure is under severe stress. India reels under a huge surge in coronavirus cases. So overburdened facilities are grappling with high caseloads. Even the biggest healthcare owners, the biggest hospitals, the biggest hospital chains, they're all feeling the stress.
Hospitals turning away patients, oxygen supplies completely choked, interstate battles leaving doctors in distress, the wailing cry for life-saving drugs. India's crushing journey through the second wave is proving a leveler like never before. With the nuts and bolts of India's healthcare ecosystem collapsing so completely that even the biggest healthcare owners are in distress. From Sangeeta Reddy of Apollo Hospitals,
getting denied healthcare,
to Dr. Devi Shetty, to Kiran Majumdar Shaw.
Nobody had attempted before.
Things are so bad on the oxygen front that the owner and joint managing director of Apollo Hospitals, one of India's most prestigious healthcare chains, had to tweet to the Prime Minister, Defence Minister and others today, literally pleading for help in letting an oxygen truck out of Haryana and into Delhi. Finally resolved after she raised the alarm on social media, Sangeeta Reddy has recommended that oxygen trucks be tagged as ambulances to enable quick green corridor movement. Another recommendation has come from Biocon chief Kiran Majumdar-Shaw, who has said, since it is doctors and nurses saving lives rather than beds, the government should consider deploying graduating nurses and MBBS doctors through COVID service by giving them credits. These are just two suggestions. Both may sound radical, but reflect the scale of India's crisis. The question is, will the government listen in time? Bureau Report, India Today.
The situation is extremely grim, but is there light at the end of the tunnel? As the pandemic stalks, COVID-19 vaccines are being used across the world. But the virus is mutating. There are new variants that are coming. The efficacy of existing COVID-19 vaccines are also being questioned. Enter the second generation technology that could change the game, or especially even vaccine efficacy could improve. The administration and distribution, that could change. We're talking about, is this now time for the nasal spray which is being tested? Take a look.
A spritz instead of a shot to ward off COVID-19. A nasal spray vaccine is the second generation technology that's reportedly showing promise in trials against a rapidly mutating pandemic. 13 companies are now working on intranasal sprays and 5 are in early clinical trials. Trials might be in early stages, but intranasal sprays to combat COVID are generating medical interest for many reasons. Number one, the nasal route has excellent potential for vaccination due to the organized immune systems of the nasal mucosa. It's non-invasive, so no injections needed. Obvious ease of administration because it doesn't require trained healthcare workers. High compliance, ideally suited for children and adults. It has highly scalable manufacturing able to meet global demand, and of course it's easy to store, low cost and easy to transport. So how does it work? The nasal spray vaccine is based on a common poultry virus called NDV, which can replicate in humans but is harmless. NDV is engineered to produce the spike proteins of the SARS-CoV-2 virus to prime the body's immune system and attack the coronavirus. The second as a treatment spray. It kills the virus in the upper airways, incubates it, prevents it from spreading to the lungs, and based on nitric oxide, a natural nanomolecule produced by the human body. The second as a treatment spray is said to be an immediate game changer. Phase 2 clinical trials of Sanotize, the self-administered nasal spray developed by Vancouver-based biotech outfit, has developed strong evidence that the treatment could become a revolutionary weapon against the coronavirus.
To 2 years to 12 years, we want to do clinical trial quickly, phase 2B or something like that, bridging a small trial without 300 or 500, whatever statistics says. We're going to do that because these vaccines can go to children without any problem.
No, which one? Your Covaxin can go to children or your nasal vaccine can go to children?
No, inactivated vaccine.
Your Covaxin?
Inactivated, yes, Covaxin. Can go to children without any problem.
In phase 2 clinical trials, among 79 COVID-19 positive people, those with a placebo spray ended up with viral loads 16 times higher than those given the actual nasal spray Sanotize. Evidence that it could be a big weapon in filling the gaps and battling COVID while we vaccinate our population. So what does it mean for India? While countries like Israel have already granted the spray medical approval, makers have applied for emergency medical usage in India. It remains unclear how close India is to approving it though. But with outstanding phase 2 trial results, it might be a good idea to give it the green light to fight the virus. one spritz at a time. Bureau Report, India Today.
Hi everyone, Preeti Chaudhary here. Hope you like this video. For latest news and analysis, like and subscribe to the India Today YouTube channel. And don't forget to press the bell icon to stay updated. Thank you for watching.